Hello and welcome. I'm here today with Salman Khan, and we're going to be talking a little bit about our trust's new internal professional standards. So, welcome. Just to start, would you like to tell us a little bit about yourself and what you do at the trust?
Of course, I'd love to. Good afternoon, Anne, and thank you for arranging this. So I'm Salman Khan. I'm an emergency medicine consultant by background. I'm currently the clinical lead for emergency medicine and ambulatory care medicine in Hillingdon Hospital. I also do a bit of trauma team leader stuff at St Mary's um, with Imperial Healthcare Trust, which keeps me uh, a bit in touch with what my colleagues are up to in the Northwest London region.
Brilliant. So, we're specifically talking a bit about the internal professional standards. So, to start, what are those and why are we introducing them?
Right. Okay. So the the technical definition of internal professional standards is that these are these clear, unambiguous values and behaviors which are expected by individuals that work within an organization. So these standards are standards that are meant to be upheld by staff within an organization. Um, and therefore they need to be championed by the staff. And depending on how well we um, try to achieve them or whether we're able to achieve them will define how we work as an organization, which will then become ubiquitous to the region around us and to our patients. So I think that these are extremely, extremely important values. And, like I said before, it really defines the culture, your work culture and your environment at work.
um, so, what are our internal professional standards?
Yeah, sure. I think one thing that's very important to understand is the internal professional standards. Although these are standards that are meant for staff, um, and our gold standard behaviors that are expected of each of us. They're all very patient centric. So at the real focus for all of internal professional standards is patient care. How we're able to collaborate together as clinicians, nursing, and other healthcare staff, championed by the executive teams, to provide the best possible care to our patients and get them to the right place the first time, ultimately trying to provide them the best patient experience as possible. So so I'm just going to abbreviate it to IPS because that's what most people just call it now. It's just a bit of a mouthful. So the IPS stuff started many years ago. Um, Various trusts had various iterations of the IPS. Some used to call them the 10 rules, the 10 commandments, whatever it is. It's usually about 9 or 10. Some trusts go up to about 18 or 20. But really, I think the first sort of national change came in 2016 when the Emergency Care Improvement Program, they called EKIST, they came up with a framework of principles of effective emergency care. And these were, again, 10 principles that defined how we should work um, when providing emergency care to our patients. Now, we know that although we all work for the NHS, the individual trusts are not identical in terms of strategically relevant resources, diversity of stakeholders, strategic groups, and organizational goals, in fact. So although there is a framework available nationally to work with, each trust has to come up with their own internal professional standards. So that's what we did. And we came up with 10 internal professional standards. When I say we, there was a large focus group. So the focus group was um, so I was leading the group discussions, but it was anything but just me. Everyone, including the execs. So Agubi, who's our ex-medical director, has just left. She was spearheading this. And together with Gubi, there was a lot of divisional level expertise. So representatives from the planned care and unplanned care division, and clinical leads of various specialities that work at Hillingdon. So I was there from an A&E, ACU perspective, but then several different medical specialty leads, surgical specialty leads. Everyone was involved in in constructing our own IPS. Because like I said in the beginning, it has to be collaborative working. And without collaborative working, you can come up with all sorts of standards. You just won't be able to embed it into your culture.
Really, it's interesting because you've touched on collaboration quite a few times, and also this idea of wider Northwest London. How does this fit within that closer working relationship that we now have with the other acute trusts?
Yeah. So in I want to say, so this is post-pandemic, so 2022. Um, so the trusts in Northwest London, and there's four of them. They decided to come together in 2022 to use collective resources and to try and come up with collaborative decision making in order to provide better patient care to the residents of Northwest London. So it's quite a wide area. What we realized was that yes, we were individual trusts, and our strategic goals may be a bit different. There was something that was common, which was the entire Northwest London population that we were catering for. And whether we like it or not, we end up working together with each other. So we try to open all communication channels. The lead for the acute collaborative in Northwest London, Dr. Julian Redhead, formed what's called a peer review group or steering group. Essentially, what we did was all the different clinical leads, operational leads, execs, you name it. I think all the big wigs really across Northwest London visited each and every site. They saw the strengths and the limitations of each site, and then there was a big summit meeting where we decided what's wrong with the service that we're providing and what is the exceptional stuff that we're doing at individual sites that we all need to strive to duplicate. What we found, unfortunately, Anne, was that the internal professional standards were not really being followed across all sites to the degree that we would have wanted it to be followed. So whereas individually we were working on our internal professional standards, it was decided at a sector level that we should come up with a sector level framework, so generic internal professional standards. And this would then help individual trusts agree their own local standards. Now, it's not reinventing the wheel. But like I said, some trusts have their own idiosyncrasies in the sense that Hillingdon, for example, doesn't have many subspecialties. So we don't have subspecialties like ENT, plastic surgery, and stuff like that. So obviously, our standards are not going to touch on those things. Whereas Norfolk Park, which has a little bit of all of that, would need to touch on their standards. So their local standards are going to be different to us. However, the essence or the spirit of the standards are going to be the same. And so that's the work that I've been doing together with the clinical leads of all the other trusts. And we have now completed our final draft, and it's been sent off to the big boss, Dr. Julian Redhead, and he's going to then get it signed off and have agreement with various execs across the different trusts.
Brilliant. So, if someone's quite new to the organisation, where can they find these internal professional standards?
Okay, well, that's where you and our lovely marketing team have come in. We came up with a big bang launch in March of this year. We printed out QR codes, and these are little cards. We printed out some A4 sheets of the internal professional standards, and it was on the intranet as well. So the link is still on the intranet if anyone's interested. But hopefully, once the Northwest London standards come out, we're going to relaunch our own IPS program. So anyone that's missed it should be able to catch up. I think the intranet link was really helpful because you could send it across WhatsApp groups, etc., which is what we normally communicate within nowadays. I know emails are still a strong communication tool, but WhatsApp has definitely made it easier for everyone to have it on their phones. So if there are any juniors who tell me, well, we don't know about the IPS standard, and I think, okay, there you go. It's in your phone now. Never forget them. But yeah, at the end of the day, and I know, that's the whole formal definition and where the strategy is taking us. At the end of the day, what we really wanted was we just wanted a nice place to work in, which I think all of us, I think whenever someone's trying to choose a job, that's what they're looking for. The people that they're working with, the relationships that that the professional relationships that they have to work with. Those are the things that really count. Um, and we felt that if our professional relationships with each other, seniors, juniors, healthcare staff, different groups, were good, then ultimately the patients would benefit from it. I'll give you an example. The first internal professional is just be nice. So all it says is be nice, behave in a professional and courteous and respectful manner to each other, and that all interactions must have a patient-centered approach. This isn't about your own personal. I don't want to use the word, but it's it's all about the patient. It's about advocating for your patients and trying to get them the best experience possible.
Brilliant. Thank you very much for your time today. I just wanted to ask one final thing before we go. Like, if there's one thing that you want people to take away from this podcast, what is it?
Okay. Um, Interesting. Yeah. So obviously, the one thing I want people to take away is we have got internal professional standards. Please download them on your phone and please have a look at them. And they have been agreed by everyone. So don't think that this is just something that we as A&E has come up with or surgeons have come up with. Everyone that was anyone was involved in this decision making, and it has to be our collaborative efforts that will make it work. But I think other than that, what I would really like people to take away from this is that. Um, at the essence, at its very essence, the internal professional standards are there to make your working lives better. It's so that you don't get into unnecessary arguments, you don't waste unnecessary time trying to do your basic level of work. Um, if so, one of the standards, for example, is that if A&E refers a patient to a specific specialty, let's say to surgery, and the surgeon say, you know what, this was an inappropriate referral, this patient is better off with another specialty, just grab the phone and speak to the medical team and refer to them if that's what you think is relevant. But don't send the patient back to us, because of course it's not a great experience for the patient, as you can imagine, getting bounced around, but also it does cause a bit of friction between the teams. At the end of the day, we're here to just make our patients' lives better and provide them with a good experience. Um, if it's streamlined and smooth, you're going to really enjoy coming into work.
Brilliant. I think that's a fantastic message for us to end on. So, thank you so much for taking the time to talk to me today. It's been really great.
Thank you. Thanks, Sam. Thanks so much.